Have you ever heard of a female erection? Did you know women get boners too? Believe it or not, a lady erection is actually a legitimate thing, and there's nothing wrong with it, even though not many people talk about the occurrence. Whether you call it a female erection, a clitoral erection, or a lady boner, it's a real and natural thing that happens to women. Much like people who have a penis, people with a clitoris can get an erection too. In fact, some mechanisms behind female erection are identical to penile erection. You may be asking right now, how does a female erection work? Or why does a lady boner happen? And should you be concerned? Watch this video until the end to have a closer look at this topic. A female erection is a phrase used to describe how the clitoris changes when a female individual is sexually aroused. The clitoris can become swollen, somewhat enlarged, and denser due to blood flow engorgement. While most people associate the clitoris with only the visible nub of flesh at the apex of the labia, the clitoris is much larger and more complex. The clitoris is actually homologous in the embryonic stage to the male penis. However, as a woman develops, the genitals take on different characteristics. Here are different parts of the clitoris. The small nub of skin. This is the glans, which is where a massive network of nerve endings come together. The clitoral hood. This is the fold of flesh that rests above the glans. The corpus cavernosum refers to the interior erectile tissues that run along the glans on both sides in an almost wishbone shape. The crura. These are the tissues that extend from the corpus cavernosum in long legs on both sides of the vagina. The vestibular bulbs. These are the spongy organs found beneath the crura on both sides of the vagina. All parts of the clitoris are affected during arousal and may even be associated with clitoral orgasm. Now let's take a look at how an erection happens to a woman. The different parts of the clitoris take on blood flow during a state of arousal, which causes an erect clitoris. During arousal, vasocongestion or increased blood flow affects the clitoral cavernosum, the vestibular bulbs, and the glands. The added pressure on these regions may cause the glands to slightly protrude and the labia to appear more swollen and tauter. Once orgasm is achieved, clitoral erection naturally subsides as the blood that once engorged the clitoris gradually filters back into your system. This same action occurs even without orgasm as the state of arousal decreases. While the same physiological processes take place when a female becomes aroused, the extent to which female erection is noticeable can vary depending on the woman. Many women may not notice major outward changes at all, while some may recognize the clitoris appears larger and more pronounced. A female erection is pleasurable, but it should not be painful or uncomfortable. Most women who have an erect clitoris will simply feel like they are highly aroused. In effect, this is what is taking place from a physiological standpoint. The clitoris itself may become more sensitive to touch. It possibly might even be a bit tingly, or as if the area is pulsating due to the heightened level of blood flow to the area. This can make sexual stimulation with a partner or even solo play more enjoyable. If you would like to know how to make a female erection bigger, keep watching the video to discover more. Much like the penis, you can encourage blood to keep flowing to the clitoral area to maintain the erection. This may or may not cause the erection to get any larger. To encourage blood flow, simply try different forms of stimulation, such as using a sex toy with suction technology may encourage more blood flow to the clit. Applying a bit of warming female arousal gel to heighten sensations and arousal. edging or stimulating to the edge of clitoral orgasm, stopping until the urge subsides, and then resuming stimulation. If you would like to know more about warming female arousal gel, check out a link in the description to learn more about it. Unlike male erections, a female erection is not quite so obvious. The clitoris may grow and harden, but it will not grow substantially in length or change positions like a penis. Instead, the signs of a clitoral erection may include engorgement of the external bud of the outward clitoris so that it looks slightly larger, changes in color, such as a deeper red or pink color due to the enhanced blood flow, slight retraction of the clitoral hood, which makes the clitoris more visible, swelling of the inner and outer lips of the labia. The vaginal opening may become lubricated. It is not always immediately clear what causes priapism in females. The primary mechanism of action that causes the symptoms is incomplete lymphatic fluid drainage of the clitoral area when arousal is not a contributing factor. However, clitoral priapism can have a few potential causes, which include taking certain medications for depression, alpha-blocking agents, taking 5-HT2 blockers. The female erection should not be confused with clitoral priapism. Clitoral priapism, also known as female priapism, is a rare medical condition characterized by an extended clitoral erection that is not associated with either arousal or clitoral stimulation. When it happens, the clitoris remains engorged with blood, even without arousal, thoughts of sex, or otherwise. Clitoral priapism symptoms may initially seem like nothing more than a female erection as described above. However, the symptoms persist even when arousal has surpassed. Here are the following symptoms of priapism in women: persistent clitoral swelling or engorgement that lasts for hours or days, aching pain in the clitoris, burning sensations, heightened clitoral sensitivity. Having an erect clitoris for a prolonged length of time can be painful and uncomfortable. Later, there is a chance that prolonged priapism in women can result in other complications. So, if a woman is experiencing priapism, it is recommended to see a care provider for an assessment or treatment. Female erection is definitely possible due to the way the clitoris physically functions, but can look much different from male erection as explained above. While a clitoral erection does happen, most females will not notice a significant growth or size difference. Don't panic about it though, because this is a perfectly normal occurrence. That's it for the video today, and I hope you got value from it. Don't forget to subscribe to the channel and hit the like button and the notification bell so that you never miss out on any new informative video uploaded. Remember, your health is your priority. I'll see you in the next informative episode.